Nutrition is fundamental to health. It prevents diseases, supports child growth, and enhances learning and productivity. The Department of Health implements several community based nutrition programs to improve the nutritional status of Filipinos, especially mothers and children. These programs include micronutrient supplementation, Operation Timbang Plus, and the Food Fortification Program, all working together to reduce malnutrition and promote a healthy population. The micronutrient supplementation program aims to prevent and control vitamin and mineral deficiencies, which are common causes of malnutrition in the country. It focuses on pregnant women, lactating mothers, and children under 5 years of age, since they are the most vulnerable to nutrient deficiencies. The program supports the Philippine Plan of Action for Nutrition, our country's strategic framework for achieving optimal nutrition for all Filipinos. Micronutrients play an essential role in growth, immunity, and brain development. When these nutrients are lacking, it can lead to anemia, goiter, stunting, and poor learning performance in children. Supplementation provides an opportunity for effective and immediate way to ensure that at-risk groups receive adequate vitamins and minerals, especially where access to diverse foods is limited. The main micronutrients provided through this program are vitamin A, which supports good vision and immune defense. Iron and folic acid, which prevent anemia in both women and children. Iodine and zinc, which promote proper metabolism, brain development, and immune system. These nutrients are lifesavers for growing children and expectant mothers alike. The vitamin A supplementation program provides capsules every 6 months to children aged 6 months to 59 months. Vitamin A prevents night blindness and helps the immune system fight infections such as measles and diarrhea. This is usually given during the Garantisadong Pangbata campaigns, nationwide health drives that bring essential health child services to communities. Pregnant women are provided with iron and folic acid tablets daily for at least 180 days throughout the pregnancy. This supplementation prevents iron deficiency anemia, which can cause preterm delivery, low birth weight, and complications during childbirth. It also promotes safer pregnancy and helps ensure that both mother and baby are healthy. Iodine and zinc supplementation program also encourages the use of iodized salt, a simple yet powerful solution against iodine deficiency disorders such as goiter and developmental delay. Zinc supplementation is provided to children with diarrhea to help them recover faster and prevent future infections. Together, these nutrients reduce stunting, promote proper metabolism, and strengthen resistance against disease. Micronutrient supplementation is implemented through rural health units, barangay health stations, and community health drives like Garantisadong Pangbata. The program involves the participation of midwives, BNS or barangay nutrition scholars, and volunteers who assist in distribution and health education. All activities are monitored under the National Micronutrient Program, ensuring that every capsule or tablet given reaches the intended beneficiary. As nurses, we are at the forefront of this program. Our responsibilities include ensuring accurate supplementation, proper recording, and timely reporting. We also conduct health education for families, emphasizing the importance of balanced diets, fortified foods, and compliance with supplementation schedules. Lastly, we monitor for adverse reactions and refer cases of severe deficiency for medical management. Despite its success, the program faces challenges. One is limited community awareness, especially in far flung areas. Some families are unaware of the benefits or fear the side effects. Supply shortages occasionally occur in remote regions, delaying scheduled distribution. And there are also cultural misconceptions. For instance, some believe supplements can cause illness or infertility, highlighting the need for continuous community education. Micronutrient supplementation program can be measured in several ways in terms of its success. First, through improved hemoglobin levels and vitamin A status among children. Second, is the increased household use of iodized salt that reflects good public awareness. Lastly, the decline in micronutrient deficiency diseases such as anemia and goiter demonstrates the effectiveness of these interventions. Let us move on to the Operation Timbang Plus or OPT Plus, which is the country's main growth monitoring program for preschoolers. It involves annual mass weighing and height measurement of all children aged 0 to 59 months. This is conducted by LGUs and barangay nutrition scholars. OPT Plus helps detect malnutrition early so appropriate interventions can be implemented. OPT Plus has three main objectives. First, to determine the nutritional status of all children aged 0 to 59 months in each barangay. Second is to identify underweight, stunted, or wasted children who may need special attention. And third, to use this data as the basis for local nutrition planning, feeding programs, and policy making. During OPT Plus, barangay nutrition scholars measure each child's weight and height using standardized calibrated tools. The results are recorded in the eOPT Plus system, an electronic database developed by the National Nutrition Council or NNC. The information gathered is used to create the municipal or city nutrition profile, guiding resource allocation and local action plans. Nurses and barangay nutrition scholars share key responsibilities in this process. They supervise the weighing activities, validate measurement accuracy, and interpret results. Nurses also coordinate referrals of malnourished children to feeding or medical programs. Through this teamwork, health professionals can closely monitor progress and support at risk families. Data collected from OPT Plus serve multiple purposes. They guide the formulation of local nutrition action plans, ensuring that interventions are evidence based. The results also help track malnutrition trends over time and identify high risk areas. Finally, These data inform policy decisions and funding allocations, ensuring that limited resources are directed where they are most needed. Next is the Food Fortification Program, which combats micronutrient deficiencies through food based solutions. This involves adding essential nutrients to commonly consumed foods, such as rice, flour, and salt. This program is mandated under Republic Act 8976, also known as the Food Fortification Act of 2000, which requires certain staple foods to be fortified with specific nutrients. Three primary types of foods are fortified in the country. Rice is fortified with iron and vitamin A. Flour is fortified with iron and vitamin A to also improve nutrient intake among bread consumers. Salt is iodized, following the Asin Law or the Republic Act 8172 to eliminate iodine deficiency disorders across the country. These fortified foods help ensure daily nutrient adequacy, even for low income households. The Food Fortification Program has three main objectives: to increase consumption of fortified staple foods across the population, to reduce the prevalence of anemia, goiter, and vitamin A deficiency through fortified rice, flour, and salt, to support food security and nutritional self sufficiency, ensuring long term health improvement through sustainable nutrition practices. The program is implemented through partnerships among the Department of Health, the DOST Food and Nutrition Research Institute, the Department of Agriculture, and private manufacturers of food. Fortified products carry the Sangkap Pinoy seal, a logo that assures consumers that the food meets the fortification standards. Promotion happens through schools, public markets, and community campaigns, encouraging families to choose and consume fortified foods regularly. Nurses and BNS play a vital role in sustaining this program. We advocate the use of fortified and iodized foods during home visits and health teaching classes. Nurses also conduct nutrition education sessions to raise awareness about reading food labels and choosing healthy options. At the barangay level, barangay nutrition scholars monitor compliance and community acceptance, ensuring that fortified products are widely used and accessible. In summary, our nutrition programs, such as micronutrient supplementation, Operation Timbang Plus, and food fortification, work together to improve growth, strengthen immunity, and prevent malnutrition. Each program contributes to a common goal: a well nourished and healthy population. As nurses, we are called to lead in education, supplementation, monitoring, and advocacy, ensuring that no Filipino, especially no child, suffers from malnutrition or preventable deficiency disorders.